I now speak to Dr. Sandra Ng'ethe, who's a resident obstetrician, gynecologist at the University of Nairobi. Dr. Sandra, thank you for your time on this. We've just heard in that piece about late diagnosis as one of the challenges that doctors face in helping patients. What are the other challenges?
Well, some of the other challenges is getting someone on treatment sometimes can have issues because the first line treatment would be hormonal treatment. So for patients who are a bit younger, putting someone on contraceptive pills is a bit daunting for the parents because sometimes it's associated with maybe some promiscuity because you're already on contraception. And the other main one is that the definitive diagnosis is made through laparoscopy, which is basically insertion of a camera inside the abdomen to try and identify these endometriotic spots. So by the time you're having surgery for something that you're not quite sure if that's the diagnosis, for the healthcare worker, we feel like we need to give time to other modalities of treatment before we go to that. So the time between the first contact and actually making the diagnosis can take quite a long time.
And we did hear a bit about that in that piece. I mean, for the late Njambi, the disease traveled to different parts of her body. Just explain how possible this is, because the tissues grow outside the uterus, I believe.
Yes. So endometrial cells are cells that grow within the uterus. So endometriosis is when the endometrial cells are outside of the uterus. So there, unfortunately, we still only have theories. So the first theory we have is that the menstruation is retrograde, that it goes backwards from the uterus to the fallopian tubes and into the pelvis. The other theory is that there's direct implantation of the cells from, let's say, surgery, and the other is that it could be genetic from first-degree relatives. So given that we don't even know what's the cause, that's part of the problem.
Previously, I've had it referred to as a woman's disease. Why is it important to talk about how male-centric medicine approaches and, of course, societal judgment endangers women's health? Okay,
so funny enough, yesterday I was on Twitter and one of the discussions was that the male aspect of endometriosis is, well, you go through it every month, why don't you soldier it on, why aren't you used to it by now, and other such things that make you feel like maybe it's all in your head. So this isn't a discussion between the women. It's not a discussion between the women and the healthcare workers alone. It's a communal thing because it's such a debilitating disease that is chronic and it's every single month. And because now it not only affects the uterus, and like for Njambi, it affected her lungs, it affects even going to the toilet, it affects going to for a long haul. So it's not just a conversation that needs to be had with just the female community. It's for everybody to realize that some periods can be debilitating.
If you can, very briefly, what advice would you have for young women, young girls as well, on especially those who have painful periods, and how they can manage their life around those cycles?
So the first thing is it's not in your head. It's not something that you've made up because some people are blessed and they only have very light periods, very pain-free. So the best thing is to first identify that it is a problem. And this goes for all people, from the school nurses in secondary schools to the school staff clinic in the university, even to the OBGYNs that all around the country. And I feel like if we identify it and know that it's something that's out there, including other menstrual problems like premenstrual syndromes and PMDD, which is also debilitating in terms of having a mental aspect, then we can also have it as a diagnosis that you have in the front of your mind when a patient comes to see you.
We're going to have to leave the discussion there. Very insightful. Dr. Sandra Ng'ethe, thank you so much for joining us on the program.